This is Red, White, and Bluegrass.
It is no secret opioid addiction has left a blemish on many communities in the Commonwealth. The governor's 2024 overdose fatality report reported over 1,400 Kentuckians died from overdose that year, and almost 160,000 received addiction services paid for by the state or Medicaid. Nicholasville Senator Donald Douglas is hoping to convince his colleagues to greenlight a bill clearing the way to start researching Ibogaine, a psychedelic derived from an African shrub to treat opioid addiction.
Ibogaine improves most of the cellular damage and most of the neurotransmitter damage in most of the brain areas that are affected by these conditions. This is why Ibogaine is so powerful and can treat such seemingly different conditions.
The drug has little research around it because it is currently Schedule 1 in the United States. Douglas will be filing his bill in the 2026 session. He filed a similar bill last session that did not get a hearing. So Representative Moore, let's begin with you here. Where do you stand on this, and is there any questions you'd want to get answered as this bill goes through the process?
Anything that's going to help us bring down opioid addiction and deaths due to opioids, I want to make sure that we are exploring that, no ifs, ands, or buts. It's my understanding that Texas passed $50 million from their state budget to go into this research there, and it's going to be matched by $50 million in private funds. And so it seems like Texas is willing to lead the way on this research. If we wanted to do something, I'd want to make sure there is proper oversight of it. I believe there is already a cannabis research team at UK that was making sure things were going properly as we looked into medicinal marijuana. If we were to do some kind of research in Kentucky, let's put it with UK or another research hospital that's able to make sure things are being done properly. I want to make sure that things are aligning with scientific method and actual research, and we're not just using the good idea fairy to start giving drugs or medications to people.
Representative Lockett, what do you think?
I would agree, and I think this is an issue where I think probably all Kentuckians agree that one opioid death is one too many. We've had over 1,400 in this state just last year. And so anything I believe that we can do to lower that number, because you get into things like workforce participation, loss to state revenue. This is an issue that is gripping our Commonwealth. And so I applaud our colleague to say, hey, let's take a step back. Let us look at something that has the possibility of working, but it's something that obviously more research is needed to kind of figure all this out.
Now, as Representative Moore mentioned, there's this big investment going on in Texas over this particular bill, or over this particular drug. Embracing a psychedelic has never really fit, the conservative brand, Representative Lockett. Texas sort of taking the lead on this, does that sort of change things amongst the broader Republican caucus in a sense? Could it? What do you think?
Well, I think this issue is one, again, I think that we have to look at the why. Why would this even be a topic of conversation? Because of the issues that we are facing in the Commonwealth. And so in terms of a conservative issue, I don't think it's one or the other. I think it's a Kentucky issue. And I think if this is something that can help Kentuckians on a low dosage, from what I understand, I'm certainly no doctor, but I trust my doctor colleague to say, let's at least take a look at this. So I think there's probably possible traction there in the caucus.
You mentioned research. How much research would you want to see, or what kind of timeline would you like to sort of see on this before lawmakers really have to decide, should we push for full legalization or some sort of medical legalization?
I'd want to defer to medical standards, industry standards, research standards. That's not what I do. I mean, I'm not an expert in the House to say exactly how long that should take. So I'm someone who wants to see what those who are professionals in the field have to say. But biggest thing is that the research is done properly. We've taken a leap of faith on medicinal marijuana. We introduced that in Kentucky. That is now a program that is slowly getting up and running. So there is kind of an opportunity here to follow along in something that we have done previously to say, we can use this thing, maybe that wasn't a psychedelic the same way, but how can we do something that is not viewed as traditional drugs or traditional medicine that helps people, that actually gets the job done that we're looking for? And so that is an opportunity for us to consider this as well.
About 30 seconds left here, guys, as we wrap up. Just overall, what kind of job you think Kentucky has done in terms of treating our opioid addiction crisis?
I think we can always do better. And I think whenever there's an issue like this that comes up that says this might be a possibility, then I think it's worth exploring. I think it's worth saying, well, let's take a look at this, even if we piggyback off of Texas and say, what are you showing now? Anything that we can do to improve our numbers, because Kentucky's numbers, while declining in terms of deaths every year, we can do a lot better, and we need to and have to do a lot better.
All right. Thank you both for your